My name is Grayzel. I got a story to tell.
It's not just for smokers or tobacco chewers, so please come on by if you don't know how to brush your teeth, especially the little ones. Dinosaur would love to show you. Thank you very much.
And Susan is really our liaison with the Oral Cancer Foundation and the co-chair of this walk. Want to say anything, Susan?
Well, thank you for coming. I think this is our best walk ever. $20,000. Woo! The
first time that we've had a dental professional on our committee, and because of Cindy, we now, this year was the first time we offered continuing education for dental professionals on oral cancer. We have some really special speakers for you here today, and I'm really excited to introduce you to them. So first, shall I thank our sponsors? I'll do that later. Sarah. Let's introduce Sarah Litzelman.
Eva told her a beautiful story about survival and oral cancer, and as a dental hygienist, we always look for speakers, any tips they give us. Well, Eva told us her story about oral cancer and her wrong diagnosis and how she survived. I took what she said and used it clinically at the college, where I had my own grandmother who is here today as a survivor. Here is she, Grandma. Before I met Eva, my grandma was just a normal, seems to be healthy person, just like all of us standing here. But after I heard Eva's story and I had my grandmother as one of my first patients, we noticed that there was a spot on her tongue. And she had a wrong diagnosis after seeing her dentist. Thinking back to Eva's story, I listened and thought, I had a gut feeling that maybe there's something else there. Well, a few months later, down the road, my grandma was then diagnosed with squamous cell carcinoma. So now my grandma's standing here today as a survivor because of early detection and because I got to meet Eva and hear her story. So I thank you guys all for coming today, and doesn't everyone say?
And because of Sarah's proactivity, her grandma was diagnosed early. And as a result, Teresa has a very good chance of survival. And obviously, she looks good, she has her speech, she's able to kiss, she's able to taste, she's able to swallow. These are all things we take for granted. And today you are going to meet oral cancer survivors, some of whom cannot kiss. They only taste their food when they burp because they're on feeding tubes. They look disfigured. You're going to meet all kinds of survivors today. And because of Sarah and her proactivity, Grandma looks great, and we hope you have a long, happy life. And before Sarah leaves the stage, it's her birthday today. So we were going to say, happy birthday! Happy birthday to you! Happy birthday to you! Happy birthday, dear Sarah! Happy birthday to you! Thank you very much. We all remember Melissa, who came to this walk aged 27. She had a sore on her tongue just like I did. But Melissa did not go to the dentist, and her mother kept telling her, "What, you still have that sore? You need to be seen by someone." Finally, her mother made her go. But it was late stage, and it was very aggressive. Melissa, as you can see right here, I want you to tell the pumpkin patch story.
Melissa loves Halloween, all her friends rallied and made a pumpkin patch for her in her backyard when she was in the hospital during Halloween one year, and she loved it. And this is her favorite time of year, so we just support her pumpkin-loving season. So our team is Mel Pumpkins, and that's kind of where it went.
Thank you. And this is Richard, her brother, and her sister just had a baby a few days ago. She put a pumpkin hat on the baby and sent the picture so that we could all see it. So ask them for the picture. Thank you, Suzanne family. And now, I'd like to introduce to you Natalie Carrillo. Natalie just had her surgery in New York. She looks fabulous. Oh, we are all really proud of you. Natalie, all the survivors you're going to meet today, it is an inspiration to see that there are medical and dental professionals who are able to diagnose oral cancer, and that with the treatments we have today, it's survivable. So thank you, Natalie, for coming out, and we welcome you.
Hi, friends. So I'm 24 days post-op, and I'm being preliminary and talking and doing everything I had feared of. So I'm trying to get back into the groove of my own life. I'm so thankful to have met you and get involved with everything. And I raised $12 million. Look at my first mouth. I have a whole team. So
actually, what's interesting is Natalie had a tattoo on her wrist. And if you ask all of the survivors, in fact, I'd like to start asking the survivors to please come forward. Mike and John, can everybody please start coming forward? So most of us have had reconstruction of an area in our mouths, Bob, and Natalie also has this scar, but for Natalie, she had a tattoo there. So when they reconstructed her tongue, they moved the tattoo. God forbid it should go to waste. They moved it to her tongue. So on the t-shirts, she has the place on her tongue where the tattoo was. I'd like to introduce each of us to you one by one. And just please tell us your name and how long you've been a survivor.
My name is Hilma Mason, and I'm a survivor for 2 years.
This is Cindy. She's had several recurrences. I can't believe I'm still hugging this woman. She is an amazing woman, has an amazing number of friends, but her latest surgery took her ability to speak. She uses the iPad to communicate, just like Roger Ebert and a lot of other people out there. But Cindy is an inspiration. Thank you for coming. I mean, that's Grandma Teresa, less than a year, right? Or less than a year. Hi, I don't know you.
I'm Rob Lorenza, and I'm a year survivor, just about a year.
Congratulations. Thank you for coming down. And this is John.
Hey, I'm a 2.5-year survivor.
So he was diagnosed the first time. He had beautiful reconstruction of his jaw. He looked great. And he swallowed normally, but his cancer came back. And then they did a more radical surgery where they had to take more jaw, pull up his muscle to build up here. So, and we are just honored that you came. Thank you. And this is Mike. He is a 12-year, right?
12 years, yeah, 12 years.
Last week when I heard Mike speak, I was really touched by the timeline he gave about how he regained his life back. Could you share that?
Let's see if I can remember. Yeah, so I kind of did a chronological of things I used to do in the past and how long it took me to get back there. So it was 1 year to get rid of the feeding tube, a couple years to be able to get back to work. It took me like 3 years to ride a bike again, 7 years to run a 5K again, and 12 years to talk about my own cancer in public.
Bob and I met online basically, and we have a mutual friend. And the friend put us in touch with each other. And Bob, could you quickly tell your story? And next year, Bob is going to do bagpiping for us as we kick off our walk.
I'm sorry I didn't bring him today. My name is Bob Grover. February 2012, I had surgery followed by chemotherapy and radiation. And so it's about 18 months now. I found a lump in my neck. I didn't do anything about it right away. My wife is consistent with me. Get to the doctor, get a check. And I didn't. I went to the doctor for a sciatica problem. While I was there, he says, is there anything else bothering you? And I said, well, it's not bothering me, it's bothering my wife. And that was that lump in my neck. Well, found out I had cancer, went down to Jefferson, had surgery followed by chemotherapy and radiation. Again, 18 months clean. I just had an MRI of my head and neck. Everything was good, thank God. And if you have faith, and if you have family and friends behind you, you get through it. Fight and fight and fight. Don't give up.
But the reason Bob did not go to a doctor, even though his wife urged him to, is because he said it doesn't bother me. Why should I go? It does not bother me.
I worked and I slept and I ate, and it never bothered me. If it wasn't for that sciatica problem, God, maybe I'd be dead now. Or maybe that moment would be bigger. But thank God, I was cutting a tree down and I got the sciatica.
So in other words, it's the non-tender lump in your neck. Feel your neck. Look in your mouth. Just like we do self-exams for breast cancer, and we know what to look for skin cancers, look in your mouth. If there's asymmetry, if it doesn't look right, get to your dentist. I mean, it's the non-tender lumps in your neck that are typically an HPV-associated problem. Yeah, and just so you know, I've met men who can't button their shirt, and yet they didn't gain any weight. That's a sign. Men who are shaving their necks, and you say, wow, I got a little bump there. Get to your ENT.
Another thing, you want to make sure you go to a good dentist. I had a dentist that never checked for any lumps, never did a screening in my mouth, just spoke to my teeth. And this is what you have down here with this screening. Get it done. And thank God I'm here. And nice to be here. Thank you.
You really have a chance to get your screening. And this isn't just a little screening. You're going to learn about a thorough oral cancer screening when you go down to this tent after our walk. This is Grayzel on our committee.
I'm a 3-year survivor.
She went to the distance. She caught it early, right? And we have some others. We have Jim. We have Jim right here. I'd like to thank our sponsors. This was really this event. I mean, the great food that you're getting, and take oranges. There's all kinds of stuff. And make sure you buy raffles, okay? But thank you to our sponsors. Well, our biggest sponsor is Valley Oral Surgery, who has been running our screen booth down there for the last 5 years. Thank you for your continued support and your dollars. MedActive, which helped Hilma with her product, has also been a major platinum sponsor. Thank you, MedActive. PPL, they have been with us every year. Jim and Susan both work for PPL, and they've been providing as a gold sponsor every year. For our silver sponsors, in your bags, you will get a Nimbus toothbrush, and they are fabulous. If you have any dental surgery, treat your gums gently, use that brush. If you know anybody who has chemo for any kind of cancer, their mouth is tender, they should be using a gentle brush so they don't introduce infection to their gums by brushing too hard. So that's what the Nimbus brush is great for. And then we have a wonderful dentist in our area, Ann Curry Astolfi. Angie, thank you for your sponsorship. And then our bronze sponsors, Faco Dental, Fallen Ice, Milham Ford, Henry Shine, Sunstar, National Pen, Pocket, 10th Street Tire, Blue. By the way, Blue has some very nice gift certificates here. So put in your raffles for that. Oral Dynamics, the Lehigh Valley Center for Dental Excellence with Dr. Chuck Castiva, NP Nursing, Miguel, who provided the food, and A Natural Alternative.